Come to order. Prayer by the chaplain.
Lord, make us instruments of your peace. Where there is hatred, let us sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. Where there is sadness, joy. O divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is in giving that we receive. It is in pardoning that we are pardoned. And it is in dying that we are born to eternal life. Lord, may your blessing be upon our hearts, upon this legislature. May it pass fair and just laws. May we grow in your grace and your goodness day by day as your people, serving you lovingly and caring. We ask this in your name.
Amen. The chaplain for today is the Reverend Joe Herzing from Our Lady of Lourdes Catholic Church in Little Falls, Minnesota. Pledge of Allegiance. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America. The clerk will take the roll. A quorum is present. The clerk will close the roll. A quorum is present. The clerk will read the journal of the preceding day.
Journal of the House, 90th Session, 2017, 27th day, St. Paul, Minnesota, Thursday, March 9th, 2017.
If there's no objection, further reading of the journal will be dispensed with and the journal will be approved as corrected by the chief clerk. Hearing no objection, the journal is approved as corrected by the chief clerk. Call upon the member from Hennepin, Representative Hornstein. For what purpose do you rise?
Point of personal privilege, Mr. Speaker.
State your point of personal privilege.
Members, yesterday the Jewish community celebrated a holiday called Purim. It's probably the closest thing we have to Halloween. And it's a Jewish festival that commemorates the deliverance of the Jewish people from the ancient Persian Empire, from a plot of a bad guy named Haman to annihilate them. And this is in the all in the Old Testament book of Esther, the biblical book of Esther, if you want to read further. And we have treats that we eat to commemorate this holiday. They're called Hamantaschen, that's Yiddish. The best way I can explain it is Representative Hertas told me, for those of you who are of Czech descent, it's a Jewish kolache. So we have those in the retiring room, and please partake, and thank you very much, Mr. Speaker. Happy Purim to everybody.
Reports of standing committees and divisions. A copy of this order of business has been placed on each member's desk. If there's no objection, the reports will be adopted. Hearing no objection, the reports are adopted. Second reading of House files.
Second reading, House File Number 33.
Second reading.
Second reading, House File Number 68.
Second reading.
House File Number 559.
Second reading.
House File Number 696.
Second reading.
House File Number 740.
Second reading.
House File Number 847.
Second reading.
House File Number 857.
Second reading.
House File Number 943.
Second reading.
House File Number 944.
Second reading.
House File Number 1012.
Second reading.
House File Number 1105.
Second reading.
House File Number 1195.
Second reading.
House File Number 1229.
Second reading.
House File Number 1243.
Second reading.
House File Number 1371.
Second reading.
House File Number 1393.
Second reading.
House File Number 1717.
Second reading.
House File Number 1725.
Second reading.
House File Number 1732.
Second reading.
Second reading, House File Number 1888.
Second reading.
Second reading, House File Number 2058.
Second reading.
Second reading, House File Number 2067.
Second reading.
Second reading, House File Number 2174.
Second reading.
Second reading, House File Number 2276.
Second reading. Introduction of bills. The following House files have been offered for introduction today. The chief clerk will report the House files and give them their first reading.
Introduction and first reading of House Files 2328 through 2399.
First reading, House Files 2328 through 2399. Report from the Committee on Rules and Legislative Administration.
Pepin from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Monday, March 13, 2017, and establishes a pre-filing requirement for amendments offered to the following bills: House File Number 5 and House File Number 1890.
Calendar for the day. The first bill on the calendar for the day is House File Number 5. The clerk will report the bill.
House File Number 5, Number 1 on the calendar for the day, an act relating to insurance, the fourth engrossment.
Call upon the author of the bill from Fillmore, Representative Davids, to explain the bill.
Thank you, Mr. Speaker and members. House File 5 is called the Reinsurance Bill. And members, earlier this year, we passed Senate File 1, which gave about a 25% reduction in premiums and had 3 or 4 other reforms in that bill. This was a provision that I hoped would be in that bill, but there were those on both sides of the aisle that said, we need to work through this, we need to slow this one down, we need to get it right. And that actually made a lot of sense. And so I've been working since then to put together a reinsurance plan to reestablish a market for 2018. Members, in 2017, we almost lost the individual market. Commissioner Rothman and the Commerce Department worked very, very hard to put some things together, and it's not the prettiest thing that we have for 2017, but Commissioner Rothman has been very clear in the committees that he's testified on this bill that we need to do something by April 1st. Now, he didn't say do House File 5 as is, or do the Helverson bill, or do this bill or that bill, but he said we have to have something in place. Companies will start setting their rates in May. We have to try and get a 1332 waiver. The department believes they can do that. It'll be a very tight time frame. So what does the bill do? This is the reinsurance bill. What the bill does, it's a bill that will take pressure off the insurance companies and hopefully get more of them in the market. It starts out with an attachment point of at least $50,000, and the top end is no more than $250,000, and in between there's a 50 to 70% coinsurance. Now the MSHA board, which is currently in place, the MSHA board would take this plan and administer the reinsurance plan. And so they would have to have at least a $50,000 attachment point, could be no more. It would go up to $250,000. They can set it in between depending on the funding that's coming in on the plan. Now, members, this is a bipartisan bill. I worked very close with the governor's office, the Department of Commerce, other members of the floor here, from both parties. Now, I hope today's debate does not get into history lessons. I'm a former history teacher, and so I know history pretty well, and I really know the history on the situation we're in today. But I really don't want to go there, but I'm sure we will, but I really don't want to, because this is about moving forward. This is about getting a bill, getting a market stabilized for 2018. I'd like to go through, and members, this is not a long-term fix. You vote on this today, it doesn't fix everything forever. By no means do I want to get that impression, but from various reports that have been done, various analysis, we're looking at possibly a 17 or 18% decrease in premiums. Where does the money come from to do this? It redirects 1% premium tax from the Healthcare Access Fund to the Premium Security Plan account, redirects $70 million annually from the taxes imposed on insurance carriers from the general fund to the Premium Security Plan account, transfers money held by the Minnesota Comprehensive Health Association, and transfers $80 million from the Healthcare Access Fund from the surplus of the Healthcare Access Fund. We are not throwing people off of MinnesotaCare. This is the surplus in the Healthcare Access Fund. So when I say this is not a long-term fix, it's not a long-term fix, because by 2019 the Healthcare Access Fund is gone, and we will have to be looking at other funding sources. Now, the way it looks to me at this point, and we do not know what's going to happen out in Washington, D.C., but some of the things we have been hearing is that the administration would send out block grants to the states for reinsurance pools. That's what this is. So block grants could come to the state, and then we could back off on some of the funding that we're putting forward in this bill today. So with that, members, I understand there's some amendments, and then after amendments, I'd certainly stand for questions. Thank you.
Members, there are amendments at the desk. Representative Murphy E. offers the following amendment. The clerk will report the amendment.
Murphy E. moves to amend House File Number 5, the fourth engrossment, as follows, and the amendment is coded A18.
Call upon the author of the amendment from Ramsey, Representative Murphy, to explain her amendment.
Thank you, Mr. Speaker, and to members, thank you, Representative Davids, for your expedited description of this short-term fix, as you describe it. When we began this session, we came in to talk about the need to find immediate premium relief for those in the individual market, those 100 or 1,000 or so Minnesotans who did not receive any form of subsidy, advanced premium tax credit, any sort of relief for the premiums that they were paying in the individual market, because the insurance companies set the rates and set enrollment caps. We knew that there were people across the state of Minnesota who were struggling to afford coverage. They were struggling to access their providers.
Members, the noise in the chamber has become quite loud. Please take your conversations to the alcoves or to the retiring room so members may hear the debate. Member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker. In the midst of that debate, one of the provisions that became law was allowing for-profit health plans to sell insurance in the state of Minnesota. It was a significant change in law dating back to the 1970s. And one of the things we didn't do when we allowed that provision to become law was do anything to protect the reserve assets held by our not-for-profit health plans currently in existence in the state of Minnesota. So for many years, the health plans participating in our public programs, MinnesotaCare and medical assistance, have earned dividends and returns and have built reserves off the work that they have done in partnership with the state of Minnesota. Those reserves are now unprotected if those health plans become a for-profit health plan. Those reserves are vulnerable. They are reserves built up after many years of participation in our public programs. They are essentially taxpayers' dollars. Attorney General Swanson sent to all of us a letter last week outlining her concern about that provision that we put into law and offered legislation for us to consider. And that is what the A18 is. Today we are talking about another step to solidify or stabilize the individual market for Minnesotans. In the work that you are doing, I've heard Chair Davids talk about how he is hoping to attract new entrants into the individual market. I can only imagine that that means for-profits. When the for-profits come into the individual market, I think it means our non-for-profit health plans will consider conversion. The reserves that they have earned over time are then vulnerable. That is why I think it is important that we pass this piece of legislation, this amendment, as we consider the individual market and further stabilization of that market. And with that, I'd ask for your vote.
Mr. Speaker.
Member from Scott, Representative Albright, for what purpose do you rise?
Point of order, Mr. Speaker.
State your point of order.
Mr. Speaker, I rise to a point of order under Rule 3.21, and I'm ready to provide advice to the Speaker.
Representative Albright rises to a point of order under House Rule 3.21. Motions and propositions must be germane. Representative Albright, do you have advice?
I do, Mr. Speaker. And Representative Murphy, you referenced the Attorney General, and I'm holding a piece of paper that if what is posited here is not possible. And I'll read you for the indulgence of those in the chamber as well. Notice to the Attorney General's office. Minnesota nonprofits must provide the Attorney General's office with prior notice if they intend to transfer substantial assets, merge, consolidate, or dissolve. Unless waived, the organization must then wait 45 days before taking the action at issue. The form to use provide the notice to the Attorney General's office about the asset transfer, merger, consolidation, or dissolution can be downloaded using the link below. And also, Mr. Speaker, with
Mr. Speaker?
We're under a point of order advice right now, Representative Murphy. Did you have another point of order?
Well, Mr. Speaker, point of parliamentary inquiry. Are we under advice or debate?
We are under advice to the presiding officer right now.
Just sounds a lot like debate, Mr. Speaker. Thank you.
Representative Albright, you have the floor.
Mr. Speaker, I'll end it with that, knowing that you already recognize Rule Point 321. Thank you.
Advice for the Speaker. Member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker. And before I give you advice, I'd like to request a roll call for my amendment, please.
Representative Murphy, you can't do a roll call on the amendment right now because we're under the point of order.
Oh, you're right about that, Mr. Speaker.
Representative Murphy.
So, Mr. Speaker, advice.
State your advice.
Mr. Speaker, we are in this bill talking about the individual market, the individual health care market. We're talking about health plans. This very body, just 6 weeks ago or so, passed a piece of legislation to stabilize the individual market and to allow for-profit health insurance companies to come into this market and sell insurance. Today we are talking specifically about a piece of legislation to stabilize the individual market. And this is an amendment that would further protect Minnesotans and the cost of their care in the individual market. I argue, Mr. Speaker, on the substance of the matter, this is germane.
Mr. Speaker.
For what purpose does the gentleman from Scott rise?
Further advice, Mr. Speaker.
State your advice.
Thank you, Mr. Speaker. And to the amendment, it is not germane under Rule 3.21, given the fact that the bill is found under 62E, the amendment is found under 62D.
Further advice. Member from Hennepin, Representative Hortman.
Advice, Mr. Speaker.
State your advice.
Mr. Speaker, germaneness is not a point of order that people rise under when they don't want to vote on an amendment. Germaneness would mean that the amendment has nothing to do with the underlying bill. This amendment is germane. It talks about how the insurance companies who would get more than $300 million of state taxpayer dollars could operate. It's completely germane to the bill under consideration, Mr. Speaker. And if the majority doesn't want to vote on it, that in and of itself is not a reason to call the amendment not germane.
Further advice for the presiding officer. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, I advise
State
to
your
the
advice.
Speaker. Mr. Speaker, this amendment is germane because the underlying bill deals with taking a lot of public dollars and giving them as a subsidy to insurance companies. What Representative Murphy's doing in the amendment is making sure that when that public money goes to insurance companies, that the insurance companies can't take lots of public money that they already have and convert it for their own use and make it into for-profit, turn themselves into for-profits, and take even more public money with them. So this is very germane to the bill. It's very important that as we discuss giving hundreds of millions of public dollars to insurance companies, that we make sure that when those insurance companies, if those insurance companies convert themselves to for-profits, that they can't take hundreds of millions of Minnesota taxpayer dollars with them. So this is very germane, Mr. Speaker, and I hope that you will rule accordingly.
Further advice for the Speaker. Members, having studied the amendment and listening to the advice of Representative Murphy, Hortman, Albright, and Liebling, I am ruling that the Albright point of order is well taken. Representative Hortman.
Mr. Speaker, I'd like to appeal the ruling of the Speaker, and I'd ask for a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call.
Mr. Speaker.
Representative Hortman.
You made the wrong call on this one. Members, what we're talking about here today is how to spend more than $300 million. And what the Murphy Amendment does is constrain what can be done with that money in very much the same way that the bill itself directs how that money will be spent. So a vote in favor of the ruling of the Speaker would be a vote that you don't want the kind of oversight that Representative Murphy has in her amendment to be considered, which is most certainly germane. And members, a red vote would be in favor of having some significant oversight on these hundreds of millions of taxpayer dollars. So members, I would encourage you to vote red.
Further discussion. Members, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll. Members, please vote. Members, please vote. The clerk will close, or member from Hennepin, Representative Pugh votes aye. The clerk will close the roll. There being 75 ayes and 53 nays, it is a judgment of the House that the Speaker shall stand. There's an amendment at the desk. Representative Halverson offers the following amendment. The clerk will report the amendment.
Halverson moves to amend House Bill number 5, the fourth engrossment, as follows, and the amendment is coded DE6.
Call upon the author of the amendment from Dakota, Representative Halverson, to explain her amendment.
Thank you, Mr. Speaker and members. This amendment is a different approach toward reinsurance. There are many ways to approach reinsurance, and I think that it's important for folks to understand that for years the state or federal government has been involved in helping to stabilize the individual market in Minnesota. We have a small individual market in Minnesota because we have a very large percentage of our employers who participate in providing group coverage to their employees. And so for years we relied on MSHA to stabilize the market. The sickest people were moved out of the market, and it incentivized younger, healthier people to be in the market, thus stabilizing the market, making insurance affordable. It's really dry explanation. Insurance isn't always the most exciting thing to talk about because we're basically talking about how to solve one big math problem for the state. And so I do agree that we need an approach that helps to stabilize the individual market for our individuals in our community who hang out their own shingle, have their own business, individuals in our communities who want to retire early, and maybe their spouse qualifies for Medicare, but they don't quite yet, and they need another option. And they need it to be affordable. And right now what we're doing is driving young, healthy people out of the market, and it's quite out of balance. However, we've talked a lot about how we cover people in Minnesota and the challenges that we've had meeting that expectations. What has been missing from all of these conversations over the years is a conversation about how we get to the underlying cost of care. Why is it so expensive to purchase health care? And what can we do about it? And so this bill tries to address that by creating what I like to think of as a virtual high-risk pool. In this case, Minnesota would share the risk with health plans with the sickest people in the marketplace, and we would work with providers to help drive down the cost of those most expensive in the marketplace. And we would have our reinsurance board look at what is driving costs and do analysis about what's driving cost every single year so that the dollars that Minnesota is investing in reinsurance is being put to really good use, so that we're using all that ingenuity that we have in Minnesota, that we've learned over the years from providing care, providing some of the best care in the country, providing some of the best coverage in the country. We're typically one of the lowest uninsured states in the nation. And so that is my approach to reinsurance. It is something that I want to be sure that our colleagues on both sides of the aisle are considering as we move forward, that we need a plan that not only provides this immediate emergency stabilization that people are looking for, but that we are thinking long-term about what's really driving the cost of care in Minnesota. And Mr. Speaker, at this time, I would just like to withdraw this amendment and hope people consider it for the future.
Representative Halverson withdraws the amendment. Representative Johnson C. offers the following amendment. The clerk will report the amendment.
Johnson C. moves to amend House File Number 5, the forced engrossment as follows, and the amendment is coded A19.
Call upon the member from Nicollet, Representative Johnson.
Well, thank you, Mr. Speaker, and I believe there's an amendment to the amendment. I'd like to move that first to get the amendment in the shape I prefer it.
Representative Johnson offers the following amendment.
Johnson C. moves to amend his amendment to House File Number 5, the fourth engrossment as follows, and the amendment to the amendment is coded A27.
Member from Nicollet, Representative Johnson.
Well, thank you, Mr. Speaker and members. The purpose of this amendment is to allow for my amendment, the A19, to be added to the bill. Actually, originally crafted, the A19 was in effect of a delete all. And I prefer it not to be that. I prefer to try to attach it to the bill so that there can kind of be a two-tier approach going forward. So I ask for a yes vote on the A27.
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker, and to the Johnson C. amendment to the amendment, I would first of all like to ask for a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Davids.
Thank you, Mr. Speaker. Members, I would respectfully ask for a no vote. I would like to debate the amendment itself without any amendment to the amendment because this is really kind of the defining issue of where we're at here. Do we do a reinsurance pool or do we do MinSure 2.0? I mean, which one do we do here? And so I think the amendment to the amendment just kind of muddies things up a little bit. And so I'd really appreciate a no vote on the amendment to the amendment so we can get to the amendment and talk about the amendment rather than the amendment to the amendment.
Discussion to the amendment to the amendment. Member from Hennepin, Representative Loeffler.
Thank you, Mr. Speaker and members. Well, I think that we need to give consumers choices. And I think what we've heard with the problem with the individual insurance market, which serves about 5% of Minnesotans, about half of whom don't qualify for federal premium tax credits, it has been unstable. And what this amendment to the amendment that Clark Johnson has would give us two routes forward. One of which is to give people the chance to buy into MinnesotaCare, a proven program that has existed for over 25 years, served hundreds of thousands of people in every corner of Minnesota, was created in a bipartisan group and signed by a Republican governor and has proven itself over the last 2.5 decades. Now, Chair Davids has an interesting concept of giving a few $100 million to the insurance companies and assuming that with us sharing the risk through a reinsurance pool, that we will get reduced premiums, we'll get better offerings in every county of the state rather than them picking and choosing the profitable counties. But we got no information in the two committees in which I got to hear the bill about how much would this reduce rates, if at all. What would the premiums be? Would these be high deductible plans or not? And Chair Davids is a pretty honest guy, and I really respect him. And he said twice, we're flying blind on this because we're into new territory and we're not sure what the impact is. It's pretty scary for me to be flying by and saying to our constituents that we're going to have an option that works when we do have one that we know works, and that's MinnesotaCare. It's proven over 2.5 decades. Every single one of us has many constituents have used it, and I think the two of them going forward will give consumers choice, and at least one of them should be able to survive and give a really affordable, decent, local option to the people of Minnesota. And so I would urge a yes vote for Representative Johnson's amendment.
Member from Hennepin, Representative Hortman.
Thank you, Mr. Speaker and members. Members, I'd urge you to vote for the Johnson amendment to the amendment. And Representative Davids, I'm surprised to see you arguing against the amendment to the amendment. What the amendment to the amendment does is it makes the MinnesotaCare amendment that we'll debate next not a delete all. It would make it an add-on to the bill, as Representative Johnson explained. And that is in the spirit of bringing all the ideas that should be on the table to the conference committee. I listened to Representative Davids when he presented the bill in the HHS Finance Committee and in Ways and Means. And Representative Davids, you emphasized over and over again, this bill isn't perfect. I don't know that it will solve all the problems. I don't know that it will solve any problems. I don't know that it's the right solution, but we got to get it in a conference because we need to get a bill out by March 31st. So if there's so much important work to do in the conference committee, then the legislators in the conference committee should have all the options about how to solve this problem in front of them. The Davids proposal only gets at one of the three problems we have to deal with. We have to deal with the affordability of premiums in the individual market. We have to deal with the stability of the individual market, and we have to deal with accessibility for people in greater Minnesota. The Davids proposal only deals with stabilizing the market. It doesn't say anything about reducing the price of premiums. It doesn't say anything about how you can access a doctor in greater Minnesota. If Representative Davids would bring to conference committee both his House File 5 and Representative Johnson's MinnesotaCare option, it puts more solutions on the table. The conference committee could ultimately reject the MinnesotaCare buy-in option. But why, when we're in such an all-fired hurry to get to conference committee and do so much work there, would we want to leave some of the tools out of the toolbox before we even get to conference committee? So members, I would encourage you to vote yes on the Clark-Johnson amendment to the amendment.
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker and members. I would just encourage Leader Hortman, my good friend, to read the bill, and then she could correct herself on something she just stated. She said it has nothing to do with lowering premiums. If you look at page 5, subdivision 2, payment parameters go down to 1. There's 6 things that this bill does, or intends to do. 1, will stabilize or reduce premium rates in the individual market. And the numbers coming in show that. So it does work on that. Increase the participation in the individual market. Well, I'll just let members read page 5, subdivision 2. So some of the things that were stated on the floor were inaccurate. Thank you.
The author of the amendment from Nicollet, Representative Johnson.
Thank you, Mr. Speaker and members. Really, I'm frankly surprised that there's opposition to this amendment. And it's rooted in my experience going door to door this fall. And I got a feeling most of all of us heard the same thing at the door. Why don't you folks compromise? Why can't you get along? Why can't you cooperate? And to be honest with you, this amendment to the amendment is offered in the spirit of compromise, collaboration, and cooperation. This bill, the original, the amendment, the A19, it comes from HF 92, which there's 45 co-authors in that bill in this body. The governor made this a primary point of his State of the State address. A similar bill, very similar bill, has had a hearing in the Senate. Senator Benson chose to hear it because realizing that this is an alternative that can be mixed in to the reforms that we need to make a fragile market more solid. So what I'm asking to do with the amendment to the amendment is to say, let's consider today attaching the A19 amendment, the concept of Minnesotans being able to purchase MinnesotaCare on that individual market. Let's consider that what this amendment to the amendment does allows us to consider that in the context of the larger bill. It's a spirit of cooperation. So if I am successful, or if we are successful in attaching the A19 amendment after the amendment to the amendment is passed, this body would be sending forward a bill that would have both the MinnesotaCare buy-in and the reinsurance reform that Representative Davids proposes. I know that Representative Davids likes to go into conference with a strong bill and a strong position from the House. I will remind him that I had the opportunity to sit next to him my first 2 years here. He was a wonderful mentor. He taught me a lot about this body. One of the principles he told me was when you go into conference, you want to have a strong House position. We have the opportunity today to present a remarkably strong position in the conference committee should we choose to both pass the reinsurance provisions in HF 5 along with the buy-in to MinnesotaCare in the A19. In order to achieve that strong position, we need to have this amendment, the A27, passed so it can be attached to the H5. I strongly encourage a yes vote.
There being no further discussion, the clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. There being 55 ayes and 75 nays, the motion does not prevail. The amendment is not adopted. Representative Johnson, to your amendment.
Thank you, Mr. Speaker and members. I think I would have preferred to enter this debate talking about how the buy-in is a complement to the provisions in House File 5, but I guess I don't have that opportunity. But I don't take a step back. I'm glad to argue today that it is far superior to what's offered in House File 5. I think it's important that we're hearing House File 5 today, or a bill on reforming the health insurance market today, because it's timely. Both the provision in this amendment and also the bill require a waiver from the federal government, and we have to have a healthy debate going forward in this month to figure out how to do that and how to do it well. By the way, I would like a roll call on the amendment.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Johnson.
Fundamentally, I think the MinnesotaCare buy-in has to be and needs to be part of the conversation of any reform of the individual health care insurance market. Fundamentally, what the MinnesotaCare buy-in is, we know what MinnesotaCare is. I know in rural Minnesota, we know what MinnesotaCare is. We know people who have benefited from it. We know people whose it's really offered dignity to their life. It's offered them basic health care. We've heard from thousands of Minnesotans about the value of MinnesotaCare. And this is an opportunity then for those people who are in the individual market to buy into that program. This would be folks who earn more than 200% of the poverty level. Fundamentally, it's a choice. And again, when I was door knocking, I heard a lot about the individual health care insurance market. I think we all did. Think back to September and October. And at that time, when I met my neighbors who were facing challenges with the rising costs in the health care insurance market, I described this amendment to them. I described to them this opportunity, person after person. I had countless conversations. And to a person, they said, that sounds like a good idea. I'd like a shot at that. And I think under closer examination that we would find that Minnesotans across the state would find this as a valuable choice, an option for them and their families as they're seeking to protect their families in the health care insurance market. I think it's a popular choice because we know it. It's been around for 25 years. It's got very strong networks. It's offered in every county. It's got the networks that are available. We've heard complaints about having to drive past your doctor. Well, you can stop at that doctor in your neighborhood or in your community if you're on MinnesotaCare. These are strengths of the MinnesotaCare program. I think if we think about who is particularly affected by that, I think of self-employed people. In my region or in my part of the state, I think of farmers who are buying their own health insurance. But the population that I found a little interesting that was very common are people about my age. I'm 64 years old. And it's not unusual for a couple, for one of us for us to have retired and one of us to be on Medicare where the other spouse has to buy on the individual health insurance market. Now, I think there's a lot of couples out there in this age group who planned for retirement. They wanted to try around 62, 63, made some assumptions about that individual healthcare market and found those assumptions weren't true. And so moving into retirement is a whole different financial picture than what they expected. Those couples would benefit greatly by being able to buy into the MinnesotaCare program for their individual healthcare insurance needs. The estimate on the cost, by the way, is that the governor's office, the governor has estimated that it would cost about $12 million to set this up. But after that, no more cost to the taxpayer. I want to say that again, because this does contrast in what we're seeing in the other part of this bill, which I believe costs around $300 million. $12 million one time to set up the MinnesotaCare buy-in, a program that Minnesotans want to be able to buy into. There's an expense, $12 million, but after that, no more. After that, no more. And so the taxpayer would not be footing the bill for this. It would become another option on the health insurance market. The buyer would pay for the insurance and be supported by the tax subsidies that are available currently through the Affordable Care Act, and presumably, if that act changes, what other tax subsidies would come with that as well. Consequently, this has a lot lower expense to Minnesotans. It's better than the other program, the reinsurance, which offers no guarantees to those neighbors of ours who are wondering what would be available. We don't know for sure if they will have available something on their list when they go to purchase individual health care insurance next fall. If we allow for the amendment, the A19, we would then be sure to offer every Minnesotan the opportunity at least for one plan. And I think that offers a lot of security to families. I find families need security, and they particularly need security in their health care and their health care insurance. So that's a reason to vote for it as well, along with the cost. My neighbors ask me, and when they talk about my role in the state legislature, they say, Representative Johnson, do it right. Do it right what you're doing. Work with the other side and get the job done and do it right. I think the A19 is the right way to do it. Offering the MinnesotaCare buy-in is an option that Minnesotans deserve. They want it. I encourage a yes vote on the A19 amendment.
Member from Fillmore, Representative Davids.
Thank you very much, Mr. Speaker. If my good friend from Nicolet would yield for a question.
He will yield. Representative Davids.
Thank you, Mr. Speaker. And Representative Johnson C., is your plan the same as the governor's proposal? And if not, how is it different?
Member from Nicolet, Representative Johnson.
Thank you, Mr. Speaker. And Representative Davids, it's fundamentally the same. I think just as you've acknowledged publicly that the reinsurance proposal is a work in progress, as is the buy-in. I remind you that I've asked several times for a hearing on this. I asked informally, I asked formally, twice for a hearing on it, so we have not had a hearing. I think my colleagues who work with me on committees, I think you know that I value the legislative process. I'm a former civics teacher, but more as a legislator. I've learned the value of the legislative process and the value of hearings. Unfortunately, this bill as written, or this amendment as written, has not had a hearing. The governor's proposal that is advancing in the Senate or for which there was a hearing is a little different from this, but nonetheless the principle is fundamentally the same, that Minnesotans would be able to buy into MinnesotaCare as an option on the health insurance market.
Member from Fillmore, Representative Davids.
Well, thank you. What would happen if your amendment became law with the claims that exceeded premiums? Who would make that money up if the gentleman would yield?
He will yield. Representative Johnson.
Thank you, Mr. Speaker. I need to hear that question one more time.
Representative Davids.
Thank you, Mr. Speaker. And Representative Johnson C., if the premiums did not cover all the claims and there were excessive claims, how would those claims be paid?
Representative Johnson.
As I understand it, thank you, Mr. Speaker and members, as I understand it, the MinnesotaCare is a negotiated arrangement between the plans and the providers. And this is an interesting facet of the MinnesotaCare program. It takes a holistic view of the patient, and that those claims that the plans are then responsible for those people within their plan to cover those charges. And so they cover it from again, a holistic point of view. I'm not so sure that situation would exist.
Representative Davids.
Well, thank you, Mr. Speaker. And Representative Johnson, that situation exists all the time. So the question is, you got the negotiated contracts with the carriers, claims come in more than premiums collected. Who pays for the excess in claims?
He will yield. Representative Johnson.
That's negotiated through the plans.
Representative Davids.
Well, thank you, Mr. Speaker. Representative Johnson, no, it's not. If you can negotiate all the plans you want, but you can have a situation where claims are more than premium collected, and from the way I read your amendment, there's no backstop to take care of those claims. Members, MinnesotaCare is not being affected here. We're talking about surpluses in the fund, in the healthcare access fund. We're not talking about cutting anyone from MinCare. Now, a couple other things. First of all, you know, in the governor's plan or in this plan, we put out some very nice low rates, and that looks really, really good. But they're picked out of the air. And the way that they'd be balanced is, you know who gets cut on this? The small rural clinics, the small rural doctors, the small rural hospitals. That's where they make up that money. So they pick a number out of the air, $450 a month or whatever it is, which certainly does not cover the costs. And it's the provider that's going to be left holding the bag here. So you're going to see massive closures of small town clinics, doctors' offices, hospitals, if we go to this buy-in. The other concern I have about the buy-in, so that's why this vote's so important here. Do you want reinsurance? Do you want a private market for 2018? Or do you want universal health care, single payer, MinnesotaCare 2.0? That's the vote. That's the vote here. Do you want a market for 2018? Or do you want to go, and they say a buy-in, well, you take the healthy people off for the cheaper rate and you have left fewer, sicker people. You've destroyed the individual market in Minnesota with the A19 amendment. That's the practical effect of it. Thank you, Mr. Speaker.
Member from Hennepin, Representative Hartman.
Thank you, Mr. Speaker. Members, Representative Davids, I wonder if you would yield for a question.
He will yield. Representative Hartman.
How much does House File 5 cost?
Representative Davids.
I believe for a 2-year period, just short of $400 million.
Representative Hartman.
Thank you, Mr. Speaker. Well, Mr. Speaker, members, that is why we should be adding the Clark-Johnson amendment to this bill. We spent $326 million in January on the individual market in Minnesota, immediate premium relief to families. In this bill, we're proposing to spend another $400 million in the individual marketplace. This is before we consider any other issue that's before Chairman Dean's committee and the Health and Human Services Finance Committee. This is before we consider how to take care of people who take care of our grandparents in nursing homes or the developmentally disabled or any one of a number of things. We're talking about more than $700 million to prop up the individual marketplace in Minnesota through the private insurers. This is not affordable. This is not sustainable. The MinnesotaCare option, what we know about it is MinnesotaCare works. We have MinnesotaCare across the state where people can already opt in and buy coverage. We know that enrollees pay their own way. The fiscal note on Representative Johnson's bill is $12 million. $12 million for people to buy in, and they can have a doctor anywhere in the state, including anywhere in greater Minnesota, or $400 million for Representative David's plan that he already has admitted he doesn't know if it will increase the likelihood that insurers stay in the market. He doesn't know if it will actually reduce premiums. He said over and over in committees that he made no promises about this bill, reducing premiums for anybody, anywhere. It doesn't make the system work better. It's extremely expensive. We know that MinnesotaCare, people would be still eligible for tax credits. Representative Clark's Representative Johnson's approach is very responsible. He says, let's not go forward until we get the Section 1332 waiver from the federal government. Families would have better access to care. Right now, we have a problem in greater Minnesota. People don't have access to the networks they need to get care all across the state. It is sustainable. This is a program that has been in place for decades and it works. So if, I find myself in the unusual position of agreeing with Representative Drazkowski that the Davids proposal is simply too expensive. And we have a problem in the individual market. So why would a conservative Republican majority not want to take a $12 million solution to conference to put up next to a $400 million solution when it's possible we can get the job done with a $12 million solution? Members, I hope that you'll vote for Representative Johnson's amendment.
Member from Fillmore, Representative Davids.
Well, Mr. Speaker, I yielded, but I don't know that there's a question, so can I have the floor?
Well, I did
You're
call
the speaker. You're the speaker.
I did call on you, Representative Davids.
Yes, you did. Thank you, Mr. Speaker. That was a very good thing to do. Okay, we're playing kind of fast and loose with some numbers here. If anyone believes that the buy-in for MinnesotaCare cost $12 million, go back and listen to the tapes from 4 years ago that said MNsure would cost X, Y, or Z. Now, $400 million for this, or, $400 million. That's what it costs for 2 years. But it costs $2 billion for the providers if we go with this plan. So it's costing somebody a whole lot of money somewhere. Plus, I'm very surprised and a bit perplexed, I must add, that my good friend, Leader Hortman, would support a plan that has to have 3 Trump waivers. The Trump administration will be writing MinnesotaCare. So I guess we're just all perplexed today. But I would suggest we vote respectfully no on my good friend's amendment.
Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Minnesotans want quality health care at a price they can afford. That should be our goal, quality health care at a price they can afford. It seems like we've gotten our priorities mixed up here. The priority is not to have a marketplace. The priority is, in the short term, to have coverage so people can have coverage as we continue to try to have a system where people can have quality health care at a price they can afford. So as we look at the 2 proposals before us, and it is really unfortunate that we're forced here to take one or the other. And I have to say, it's really a rare thing when you see an author's amendment that's simply intended to adjust his original amendment, get a roll call vote and be voted down. That is a really unfortunate and I think not very respectful thing to do. But nevertheless, here we are with an either or. So I think the goal in the short term, as we look at what we're going to do with coverage in Minnesota, is threefold. And I think that the Department of Commerce has talked about this. We need stability. Now, what does that mean? I think it means that there has to be something for Minnesotans to buy in 2018. For those who are looking to buy their own insurance, there has to be a product that they can buy that suits their needs. Secondly, the product has to be affordable. It means very little to say that there's a product you can buy if you can't afford it. And thirdly, that product has to allow people to have actual access to health care. I think there should be very little debate about that. It does nothing to buy an insurance product if it doesn't give you access to actual health care. So this is how we should be measuring these proposals that are before us. Now, the original bill that this amendment would replace is a subsidy to insurance companies to the tune of almost $400 million over the next biennium. And although Representative Davids directs us to a part of the bill where it sets sort of goals for this board to try to meet, there is absolutely nothing in the bill that requires insurance companies to reduce their premiums or to reduce out-of-pocket costs for Minnesotans. So the legislature here is proposing to give a subsidy to insurance companies to remove from their shoulders the cost of health care for people that they are insuring. I thought that was what insurance companies are supposed to be doing, taking on the burden of health care when they sell you a policy. But no, no, no. What they would be doing under this bill is sort of taking on half a burden or some portion of a burden, and we don't even know what that burden would be. Because this board that's in law, which is a majority of people who work for health insurance companies, would be making decisions about how much the insurance companies would be getting as a subsidy. And let me just repeat that so it's very clear. The board that is set up in the bill is 11 people, 6 of whom are appointed by the insurance companies. So the Fox will be totally watching the hen house in this bill to decide who gets how much of this money will go out to insurance companies. And yeah, there are some goals set out in the bill, as Representative David says, but those are just goals. There is absolutely nothing that requires the insurance companies themselves to do anything in exchange for these subsidies. And that is the problem we have. So when we measure this underlying bill, this subsidy program for insurance companies against the goals, what do we see? Well, probably the best we can say for it is that insurance companies may decide to sell a product because, boy, it'll be a really good deal for them. They can make a whole lot more money, whether they're for-profit, which the Republicans in the legislature have now allowed, for-profit companies, or whether they're nonprofits building up bigger and bigger reserves, they will be making more money under this bill. What the MinnesotaCare buy-in program does is it guarantees that there is at least something for Minnesotans to buy. So there's a very important contrast. Affordability. There is absolutely nothing in the subsidy that requires affordability. Now, there is in the fiscal note, there's an estimate that there could result in a drop in premiums. But again, there is absolutely nothing that requires insurance companies to do that in exchange for the great big subsidy that this bill is giving them. However, MinnesotaCare, we know, has been an affordable option. Now, I do understand that it's because rates to providers have been low and all of that. But one thing you can do with MinnesotaCare is you've got a sliding scale, and that sliding scale could be adjusted. When we look at the subsidy bill, if any of that rate reduction filters down to Minnesotans, it will filter down the same whether that Minnesotan is a billionaire or just somebody getting by. In other words, it does the thing that Republicans were complaining about when we talked about the subsidy program for 2017. Republicans were complaining, this gives the same money to everybody regardless of income. Well, guess what? The Davids bill does exactly that. If people get a reduction in premiums, that premium reduction goes the same to everybody. That is not usually the way we like to use public funds. But MinnesotaCare is sliding scale, it can be adjusted, and it is affordable. And finally, access to health care. Access to health care is something that I know the Greater Minnesota members are particularly concerned about. We've heard a lot about how these narrow networks don't have providers who are near your home, that often you have to drive by a clinic that you used to use because your insurance company doesn't cover that clinic. Well, guess what? MinnesotaCare has a very broad network. So under the MinnesotaCare option, there is actual access to health care. Under the subsidy program in House File 5, there is absolutely no guarantee of improved access to health care. In fact, there probably wouldn't be any. There's absolutely nothing here to even encourage the insurance companies to do that. So I think there's a very clear choice here. The MinnesotaCare program, buy-in program, yeah, it does need hearings. It needs some adjustment. It is not perfect. But the subsidy plan that is before you today as a solution to the problem of individual market health insurance being really expensive, it's not a solution. It's not a solution. All it does is give a great big gift to insurance companies, either nonprofit like we have now, or the for-profits who may enter the market with this great big tantalizing incentive dangling in front of them. So please vote yes on the Johnson amendment.
Member from Washington, Representative Dean.
Well, thank you, Mr. Speaker and representatives. I'd like to just go back to a little dream I had earlier this year when I woke up and I opened up the Star Tribune and it said, Governor Dayton proposes MinnesotaCare for All, an expansion of MinnesotaCare, the public option, just putting everybody into a public program. And I thought, wow, that's unbelievable. This whole thing about President Trump and Speaker Doubt and the majorities in the House and the Senate, that must have been some kind of a dream. And we must have President Hillary Clinton, and we must have Speaker Melissa Hortman. I thought, oh man, this is not a good situation. Here we got this public option. Oh boy, MNsure's probably going to be here forever. Oh, we're going to have this more public option stuff, and Obamacare just rolling right down the rails. And then they said, no, actually, we did win the majority in the House, and we did win the majority in the Senate. And I'll be darned, Donald Trump won the White House. So I said, what in the world are we doing here with this? So I just read further through it, and I thought, actually, this wasn't, I mean, they're serious about this. Doubling down on Obamacare, doubling down on MinnesotaCare, public option in Minnesota. This was President Obama's dream, was to have a public option so that the public could compete with the private, drive the insurance companies out of business. This is kind of the idea, was that the government was going to win that battle. Well, it didn't really work out too well. And Minnesota paid the price. There was a big swimming pool called Obamacare, and all the states were supposed to run and jump in. We were the first ones. And lo and behold, there wasn't any water in it. And we didn't figure that out until we hit the bottom. But I tell you what were the goals of Obamacare? We wanted to have choice. We had choice in Minnesota. We had 4 more choices in greater Minnesota. Look around the counties around the state, we had that. We wanted below 8% uninsured. Look at the state of Minnesota. We wanted high quality. Do you know how many states have higher quality than the state of Minnesota? 0. We wanted low cost. We had that. So we were high quality, we were low cost. We had a program for low-income Minnesotans called MinnesotaCare. We had a program for people who were hard to insure with pre-existing conditions called MSHA. We met every single metric of Obamacare in 2007. But yet here we are. So along comes the Medicaid expansion in Minnesota. We expanded Medicaid. We took MSHA, our plan that took care of people with pre-existing conditions, and we put that on mothballs. We took all those sick people and they jumped into the small group market, or the individual market, excuse me. We took all of the folks that were in the individual group market, and they jumped into the public plan, MinnesotaCare. So now our individual market is half as big and twice as sick as it used to be. And the price went up, went through the roof. And so now what we want to do, Representative Davids has another bill to try to bring back the individual market, to try to throw it a lifeline. And now what are we doing? The proposal is to put more people in a lower reimbursing plan called MinnesotaCare. Now, MinnesotaCare was born in the early 1990s to serve a completely different population, low income. This is middle income folks, and this is a different population. Now we're looking at it for everybody. But let me just point out a little bit about that, for why that's a bad idea, particularly if you live in greater Minnesota. 33% of our state gets its insurance from a government source. But 63% of hospital payments are from a government payer. So let me say that again, 33 and 63. 33% of Minnesota is on a government plan, 63% of hospital payments come from a government plan. Why does that matter? If you send a bill to MinnesotaCare and you send a bill to a private insurance company, MinnesotaCare pays half as much, okay? So tell your local hospitals, your critical care hospitals, that you're going to put more people on the plan that cuts their bill in half, that cuts the payment in half, and tell them how they're going to keep their doors open. That's the plan before you. 63% of the people are already on a government plan that pays below cost. And now you're going to put more people below cost in greater Minnesota, in Detroit Lakes. How is that hospital supposed to keep its doors open if we're paying below cost, and we're going to double down on paying below cost? If you do this, if this plan were to go through and become law, and the governor's plan was to go through and become our policy, you would collapse the individual market on day one. Why would there be an individual market if people could instantly jump into the government program? On day two, you would collapse the small group market, because if you're a small employer and you can get rid of all of your employees, put them all on the public plan. Why wouldn't you do that? Then go ask your small hospitals, your critical care hospitals, how they're going to afford this. You will collapse this market by putting more people on an underpaying program. You know that. You know the math on this. I think that's why you withdrew the earlier amendment. So let's have a real discussion about trying to save the individual market in the state of Minnesota, one that was subsidized because the high-risk population was taken out through MSHA. This plan does something very similar to that, the one that Representative Davids is doing. But simply to go to a basic health plan, one-size-fits-all, top-down government, Soviet-style plan is wrong for Minnesota.
Member from Sherburne, Representative Zerwas.
Mr. Speaker and members, when I look at this proposal, I too am shocked. Clearly what we have here is MNsure 2.0. It's the sequel to a failed MNsure. You know, Hollywood usually doesn't pay for sequels when the first one is a failure. I guess we'll learn someday, perhaps. And so the sequel's never as good, members. The sequel is never as good. And that is true with this as well. MNsure 2.0 will destroy the individual market. It will destroy competition, and it will fundamentally collapse our medical providers, especially rural providers. Members, I had an opportunity just over a week ago to go and speak to a group of medical clinic managers. And there was another member there that also spoke to that group. It was a member from the DFL caucus and myself. And the member from the DFL caucus started talking about this great plan to have MinnesotaCare take care of everyone. And one of the medical clinic managers stopped the member halfway and said, "That's our lowest reimburser. If you increase the number of patients under MinnesotaCare, I won't be able to keep my doors open." And every other medical clinic manager in the room nodded along and shook their head. And so the member said, "Well, we can raise the reimbursement rate if we need to." And I said, so then I chimed in and said, if the reimbursement rate increases, then the premium would have to increase, because members, at some point, eventually, the math has to matter. We're talking fundamental math. You cannot take a group that does not reimburse costs at even 50%, add 250,000 or more Minnesotans onto that plan, and expect providers to say, "Well, this is great. We don't need to ever cover our costs. Come on in. There's no wait. We can employ just as many people. We can give you all the same tests." No, at some point, even your clinic in Baudette or Farmington or Fairmont, they need to make payroll, and they need to keep their doors open. Representative Clark Johnson, your amendment would not do that. Your amendment would close down facilities across the state. You made the comment earlier about the open network and people wouldn't have to drive past clinics. Well, I almost agree with you, Representative Johnson. Members wouldn't have to drive past open clinics. Now, they might have to drive past boarded up and closed clinics, but there wouldn't be many open clinics left after this went through. Because it is fundamentally unsustainable to allow a subprime reimbursement across the entire system and then expect the system to flourish. The math doesn't work that way, Representative Johnson.
Member from Nicollet, Representative Johnson.
Well, thank you, Mr. Speaker, and members, and most importantly, Minnesota. It's time to cut through the political rhetoric and the gloom and doom. Let's remember what we're talking about here. We're talking about the individual health insurance market. It's about 5% of Minnesotans. This isn't about putting all people into MinnesotaCare. No, not at all. This is about saying to Minnesotans, if we do this, Minnesotan or a person who's buying in that market, you can buy the Medica plan, or you can buy the whatever plan's available, but you can also buy the MinnesotaCare plan. It's your choice. You analyze that. Every family will take a good look at it. We all know this is a really important choice for families. And all we're talking about here in that 5% of the healthcare market, that those families have the opportunity to choose this as what would fit best for their family. I don't understand what's so bad about that. As far as the math does matter, I agree with you. The estimate is that it would cost, the estimates, according to the governor, is it would cost $469 a month per person. That's a competitive rate. That's a good deal. It should also be noted that this is a quality set of services. It's not a scant set of services. It's a very complete set of services, again, with a network that's available locally. There was a challenge on the number. That it was suggested that it came out of there. No, the governor's office assures me that the numbers are verified by independent actuaries, the very people who would be doing the verification work on the reinsurance program. Okay, these aren't numbers made up. They've been calculated. My guess is there may be some more work needed on those. I understand that, but we're in the ballpark there at $469. As far as cost of providers, that is a concern. The rates to providers is a concern. In the Senate, they suggested, well, maybe we should look at using the Medicare rates. I suppose that's possible. If this bill ever got a hearing, we could look into that closer. But I also want to share with you what my conversation with the president of a clinic and hospital in my district. And what he said when I said, you know, this is what I'm promoting. I intend to move on this. You'll notice the governor's promoting this. I said, what's your reaction? He said, it's a great idea. And I probed a little bit. He said, you know, what I need is people covered. What I need as a president of a hospital and clinic, I need the people that I serve in my hospital clinic to be covered by insurance. What kills them is when they don't have insurance. When there's a car accident, a severe car accident that brings somebody into that emergency room, the cost is astronomical. If the people in that car accident don't have health insurance, good luck chasing that debt. It's really hard to get. And so his point was clearly that we want more people covered, and he would be glad to have people covered with MinnesotaCare to fill in that little gap in that 5% of the market to make sure the coverage is there. It helps him balance his books. My guess is he can plan on the rates. He can budget for that. He knows what those are. When they're putting out their budget and when they're planning for the year ahead, they can base their business profile, their business strategy on that. They can't count on the cancer patient who lives in that community, who they will care for. They can't account for a car accident or two or three or how many there may be and the extraordinary expense of that. So I'm not so sure that that's as big an issue as well. Finally, the point about President Trump. And Representative Davids, you raised a question. You know, it's interesting watching the Trump administration take form, and especially as they've been working on the Affordable Care Act. Just today, the Commissioner of Health and Human Services, the Secretary of Health and Human Services in Washington, D.C., Dr. Price, sent a letter to the governors across the state, across the nation. He said, and I quote, the administration's top priorities include improving patients' access to and affordability of care. I think this meets that test. Further on, he talks about increasing consumer choice. He writes that we are seeking to empower states with new opportunities that will strengthen their health insurance markets. And then he says that to receive approval, the state must demonstrate that a proposed waiver will provide access to quality health care that is at least as comprehensive and affordable as would be provided without the waiver. Will provide coverage to at least a comparable number of residents of the state as would be provided coverage without a waiver, and will not increase the federal deficit. Members, Minnesotans, this measure passes that test. I found it interesting. I don't know how, for those of us who attended the One Minnesota conference in the fall, and there were two experts on health insurance that were there. And of course, I listened. I think we all listened pretty closely. And it was fun to get their take on what was going on with the federal government. And the question of waivers with the Trump administration came up. And they suggested at that point in time, this was in early January, they said, based on what we've been looking at the Trump administration as it's taken form, is that they may be much more likely to accept waivers than the Obama administration would have been. And I think the letter from Dr. Price today suggests just that. We have a chance again to do this and to do this well. And so members, I encourage you to keep looking at this, because this is something that people in your district is something that they can buy on that individual market, that small slice of the health insurance market that makes sense for Minnesota's families.
Member from Scott, Representative Albright.
Thank you, Mr. Speaker. Would the member from Nicollet yield to a few questions?
He will yield. Representative Albright.
Representative Johnson, you talk about, and I've heard from Representative Liebling, that we need something to buy, that we need to provide something to buy to the people who are concerned over it. I'm just wondering if you've had any conversations with the insurance companies, and if you could elaborate for us on their thoughts in terms of what types of products they intend to bring to the market in 2017.
Representative Johnson.
Thank you, Mr. Speaker. Representative Albright, I don't know if I've had many conversations with people who sell insurance, okay? And I think they are in tune with what's coming forward, and I think they have a good sense of it. One of the suggestions that was made to me, and I'll throw it out here, and I would hope that this would come out in hearings if this can get to conference and have a series of hearings and really looked at, is the value of having insurance agents receive a fee for signing people up in this part of the individual market, in that they think that would attract more healthy people to it, and would also provide an incentive, an appropriate incentive to insurance agents to consider this as an option. It's just one of the thoughts I've heard. But I heard the testimony. There's concern from the insurance companies. I understand that, but I'll tell you, competition can be a good thing, and this is another look at competition in the state. Gives another choice again for Minnesotans in that market.
Representative Albright.
Thank you, Mr. Speaker. Representative Johnson, where was that enthusiasm for competition in 2013? The question that I've heard over and over again is we need to have a spirit of cooperation and compromise. I remember sitting on this floor in 2013, listening to countless speeches talk about the manner in which that MNsure was going to be rolled out, and that it was going to be full of network options and full of opportunities for patients. I remember hearing some things as, if you like your health plan, you can keep it. If you want to keep your doctor, you can keep it. Estimated cost should be reduced by $2,500. I guess you were wrong on that one. There is zero chance that you're going to find any insurer bring a new product to the market because of the A19 amendment. Mr. Speaker, would the Representative Johnson yield for a question?
He will. Representative Albright.
Representative Johnson, under your MinnesotaCare expansion, who would manage the collection of premiums?
Representative Johnson.
Well, thank you, Mr. Speaker. Representative Albright, first of all, we call it the MinnesotaCare buy-in because individuals would be buying into it. I assume that it would be done as any whoever managed that part of the program, you would pay through them.
Representative Albright.
Thank you, Mr. Speaker. The way I read it, DHS is going to take care of the collection of premiums, and I think that that is offered through MinSure, and I think we can all agree that the MinSure hasn't worked out so well. So what you're really saying is that actual access to health care is going to go down. They can't even collect the premiums as far back as 2014. And now we're saddling them with an additional responsibility, or your suggestion is to do so. Would the representative continue to yield, Mr. Speaker?
He will yield. Representative Albright.
Representative Johnson, you speak to it only costs $12 million to put this, and this is a one-time cost. So my question to you is, how many additional people do you expect that would enroll under the MinnesotaCare option?
Representative Johnson.
Thank you, Mr. Speaker. And Representative Albright, that's hard for me to estimate. My guess is there would be probably 10, 20,000 families that would select this on the individual market. That's my guess. I have no way of knowing. The point is it's like any other market. Until the product's put out in the market, you wouldn't know what that is. But that's the beauty of the market. If we allow Minnesotans to purchase this, they will respond with their feet. And if it's a good program, if it's a plan that works well for those families at a price that they can afford, we'll see larger numbers of people choosing to purchase that. I don't see what's wrong with that. That serves Minnesota families well, and that's the point of the amendment.
Representative Albright.
Well, that certainly sounds like the MinSure 2.0 scheme that I'm hearing so much about. Quality health care at a price that they can all afford. But to your point and to your response, Representative Johnson, DHS did do an estimate on this, and they estimate 100,000 people additionally will enroll in your MinnesotaCare option. So if we just take the premium difference between what's going on right now between the plan and the MinnesotaCare option, that's $100 per member per month. That adds up to $120 million per year that would be responsible to take care of business under your amendment. So who's going to pay for that? Is it going to be the taxpayer? Is it going to be the private employer? The policyholder? You're saddling us with costs that go on in perpetuity without a cap. Members, this is a plan that will see more and more families saddled with $40,000 out-of-pocket costs per year before $1 of coverage. It's unsustainable. It begs to be voted down quickly. Thank you.
Member from Sibley, Representative Gruenhagen.
Oh, thank you, Mr. Speaker. Representative Johnson, I know you mean well, okay? You have a good heart, and we've talked on a number of issues already. But I do have to say that I had I believe that the expansion of government-run healthcare programs just will not only provide lower reimbursement to doctors and hospitals, okay, but it will actually damage our healthcare system. And what I mean by that, one of the best in the world. What I mean by that, I had a doctor from my district visit me a couple of years ago up here. And he shared with me his concern. He was still an independent doctor. He wasn't an employee like so many doctors are now. And he said for an office visit, and these numbers probably have changed, but for an office visit under medical assistance, he gets $17 reimbursement. Under Medicare, he got about $34. Under private insurance, he got about $54. He said, I lose money on Medicaid, I lose money, where MinnesotaCare would be, I lose money on Medicare, and I make money on private insurance. He said, my problem is I'm seeing more and more Medicaid people and more Medicare people and less private insurance. He said, I cannot sustain my practice with that type of a formula. So, the problem, because government reimbursement, medical providers lose money on every deal and they try and make it up in volume. So Representative Johnson, if you were to go forward with your proposal, I think you should include a oral amendment changing the name of doctors to widget makers, because that's what they're going to become. They're going to try and push through as many patients as they can in a short period of time in order to generate revenue to keep their clinic going. You're not only going to damage, again, the health insurance market with your amendment, you're going to damage the health care and the access. Many doctors are refusing Medicaid and Medicare across our country and even in our state. You can go to the website AAPS, which is the Association of American Physicians and Surgeons, and these are doctors who have opted out of the system. They call it a box of micromanagement. Let's get back to true professional medical care, allowing access for everyone, and that's partly to start rebuilding the private insurance market. Finally, members, to the degree that we expand government-run health care, you're going to wind up with a two-tier health care system, one for the rich, the privileged, and the connected, and a second-rate health care plan for the rest of us, because the reimbursement will be so low and the access will be reduced, and you will actually hurt and damage people's ability to get health care. Please vote no on the Johnson Amendment. Thank
Member
you.
from Ramsey, Representative Murphy.
Thank you, Mr. Speaker and members. And I'm up before I expected to be, mostly because Representative Zerwas was making reference to an event that he and I did together. And yes, I was the person saying that if we wanted to, we could raise rates. And yes, we could. In the Senate, when Senator Lori offered this amendment, he did it with Medicare rates, which would bring the rates up, which is something that we can do. It's in our control, Representative Gruenhagen, it is. I talked to Representative Dean, Chair Dean, a number of weeks ago about hearing this proposal in the committee because I thought it was important for us to work through the idea. He didn't want to give it the light of day, and I understand that from a political perspective. But from my ear and from the work that I have done, we have become all politics and almost no policy when we talk about health care in this body. And there have been a number of assertions that have been made on the floor today that are just flat out wrong. They're just confused, calling MinnesotaCare MinSure and interchanging those two things and talking about how PMAP works for 25 years. MinnesotaCare and medical assistants have been part of the prepaid medical assistance program. People have been paying their premiums in MinnesotaCare. They're getting coverage through our health plans. Health Partners, Medica, Blue Cross. It's been working for 25 years. The world has not come apart. And yes, providers get paid a little bit less there. That's a policy discussion we should have had in the committee, looking at the reinsurance proposal for its weaknesses and its strengths, and the MinnesotaCare buy-in for its weaknesses and strengths. But we have walked away from a policy discussion, a smart policy discussion about health care in Minnesota, and we have walked away from that. It's been at least 6 years, probably longer than that, where we have talked through together, even privately, what would work and what wouldn't work. Today, in the press conference that was held before we came to the floor to talk about this bill, a woman who lives in the district I represent said she's paying $30,000 a year out of pocket for her coverage and drug costs. And I can only imagine what she is thinking if she is listening to this debate. There are Minnesotans across the state who are struggling. They have told us, and I heard about it on the doors, and I've continued to hear about it in the district I represent and in other places, and I know you have too. And you have a political ideology, and so do I. But that has got to come second to our ability to try and solve a problem for the people of Minnesota. And if we're honest with each other, the underlying problem is cost. Cost is driving up premiums. Cost is driving up the overall expenditure of health care. And the bill that is before us today doesn't do a thing about that. Not one thing. We are going to give some more money to the health insurance companies. Hopefully we'll stabilize them, but in testimony they said they didn't know. It's uncertain. There's so much uncertainty. We don't know if it will stabilize the market. We don't know. They testified to this. If it will reduce premiums, we don't know if it will expand the networks. Nearly $400 million at this point in this session, we're willing to spend, you're willing to spend, to give to insurance companies, and they tell us we don't know. MinnesotaCare is not a new idea. It's not a new program. It's been in place for 25 years. People have been getting their coverage through there for a long time. Let's stick to the truth about what it is and what it isn't. Because how are we going to serve the people of Minnesota if we can't do that? We owe it to them. I hear you arguing for insurance companies and for a private marketplace. That can be your priority. My priority, our priority, Minnesotans. And they are counting on us to look out for their interests to make sure that they have got affordable care. I thought that's what you wanted too. But today, all you're offering up is a political argument, hyperbole. We're not solving the problem for Minnesotans. There's no guarantee that this bill solves a problem for Minnesotans. And it is time, it is past time for this legislature to step away from the political arguments around health care and get back to the work of solving problems for Minnesotans.
Member from Freeborn, Representative Bennett.
Thank you, Mr. Speaker. And members, I'm listening to this conversation and I'm thinking back to 2013 when I was a regular Minnesota citizen who basically had not much idea what was going on up here. But all I know is after 2013, our health care in Minnesota was basically destroyed. Our costs have gone up, our access has gone down. Minnesota went from being one of the top in the nation, the top states, to being the top of the nation for costs and lack of access. So now I feel like, after listening to this talk, I feel like deja vu. Because now that I'm up here, not a regular citizen, but up here and able to listen to this on the floor, I remember going back and listening to some of the floor debates that happened in 2013. And I listened to Representative Albright and Representative Dean and some of the others. And they're saying the exact same thing back then. And I wonder, did they have a crystal ball to know what was going to happen? Because everything that they said was going to happen did happen. And now I'm hearing the same arguments that from the other side of the aisle here, that we're going to bring down costs and this is going to be the best thing. And I'm hearing these people say again, no, this is not going to work. Members, I'm going to believe these people because I believe they know what they're talking about. They did back in 2013, and I believe they do now. So I guess I know who I'm going to listen to. And Representative Davids, I think you have a great bill, and we need to keep that bill as it is. Thank you.
Member from Olmsted, Representative Liebling.
Well, thank you, Mr. Speaker. And, well, I guess that you're going to listen to the members of your party no matter probably what else gets said. But, you know, there's a problem here, and that is that somebody was afraid to give this bill a hearing. It needs a hearing. It needs to go through the regular process so that we can find out what testimony providers and others have to give about the bill. We've heard a lot of Republican members stand up and make broad statements about what Representative Johnson's bill does, just making up numbers and making up what people think, and we need to have hearings so that people can actually come in on the record and weigh in, and we have some facts to go off of. And that has not happened, unfortunately. Representative Murphy also mentioned this, but I also got on the list here to say that this term that's gotten thrown around a couple times, MNsure 2.0, that's totally meaningless. You know, MNsure, I know that for Republicans that's been a big boogeyman. MNsure is a marketplace. We're not talking here about a marketplace. MNsure could be there or not be there. It's not going to make any difference to the things we're talking about here. We're talking about insurance plans. Whether you buy your plan through MNsure, through that marketplace, or you buy it not through MNsure. This is not about MNsure. So, you know, one of the things, I know Representative David started this discussion by saying let's not go back and talk about history, and I think members for the most part have tried not to do that, but I'm starting to hear that creep in from the Republican side. And I just have to say that if we want to talk about, if you want to go and relive and talk about the fight about Obamacare, one of the things that you should do is listen to hospitals and providers in the state. You know, what we stand to lose here in Minnesota, if Republicans in Congress repeal the Affordable Care Act, we will lose billions of dollars coming into this state. Now, I never thought that the Affordable Care Act was the solution to all our problems. I never did. But it has certainly done well for our healthcare industry in this state. So I don't, you know, when people want to stand up and talk about healthcare has been destroyed, that's just baloney. Now, it's true that for some people, rates have gotten really high. That's really, you know, it didn't solve all problems. There were a lot more people in the state that couldn't get insurance at all before the ACA. So, you know, when the insurance rate has gone down substantially from about 9% to about 5%, you got to say there's got to be some benefit. So I think it really depends on, as usual, where you stand kind of depends on where you sit. So for some Minnesotans, their premiums are a lot higher than they would like, and that is something that we're trying to struggle with here. But for others, they had no coverage, and now they do have coverage. And just finally, I wanted to, well, a couple things. I wanted to say a comment was made about getting up in the morning and thinking, oh, who got elected? Who got elected? What world are we living in here? Well, I just want to remind members that we still have a Democratic governor. And the governor has something to say about this too. And what Representative Johnson is trying to do here is come to a compromise where the governor would be willing to sign it. But I think that what the Republican majority wants to do is completely own this solution. And the solution that you've brought to the table is a big fat subsidy for insurance companies, whether nonprofit or for-profit. And, you know, I don't know what you think. If the governor, you just expect the governor just to sign that just because that's your solution. We still have a Democratic governor in this state. And finally, I wanted to say Representative Dean mentioned a Soviet-style plan. If this is a Soviet-style plan, President Trump should absolutely love it.
Member from Ramsey, Representative Fisher.
Thank you, Mr. Speaker. There's a couple of things that we need to keep in mind here about the amendment that Representative Clark has put out. First of all, we've heard the number, $496. That's what it would cost this year. I've had a number of people in my district who say they would have been happy to have had this option this year because they would have saved substantially more money than they are paying right now and had much better coverage. And there are others who have mentioned to me, I could have gone to a clinic in my area because I would have had coverage throughout the entire state. The current options aren't working. This is not mandatory. This would have been optional. I think this would have been a great way to go.
Member from Olmsted, Representative Quam.
Thank you, Mr. Speaker and members. I've heard a lot about money. I haven't heard a lot about the people that, frankly, if you have one option, there's no choice. First thing I heard a few years ago when we changed Minnesota's health care was from people that were on MinnesotaCare, and their children could not go to the same doctor. They could not go to the same hospital. So frankly, this amendment, this bill is more than money. It's about people. And frankly, we should give the people a choice and the option instead of continue the route of taking away options, taking away choices until there's little or nothing left. So let's stop talking about the cash and talk about the people.
There being no further discussion, the clerk will take the roll on the amendment.
Mr. Speaker.
Members, we are under roll call vote right now. Members, please vote. What? The clerk will close the roll. There being 54 ayes and 77 nays, the motion does not prevail. The amendment is not adopted. There being no further amendments to the desk, the clerk will give the bill its third reading.
Third reading, House File Number 5.
Third reading. Member from Rice, Representative Bly.
Thank you. And I know you didn't see me, but I did stand up before the end there. You know, I'm a little confused about our discussion and listening to the history of things. And we don't compare ourselves very often here to other countries, but, you know, we pay more for health care than any other modernized country. And we also believe, unlike other countries, that insurance should be in a marketplace.
Members, the noise in the chamber has become quite loud. Please take your conversations to the alcoves or to the retiring rooms so that members may engage in the debate. Representative Bly, you have the floor.
And many of these other countries began their discussion about what kind of health care they would offer to their people by saying, let's make sure they can get health care. And when I was in France traveling, I got very sick. And I told the hotel manager where I was staying, and they called a doctor, and the doctor came to my hotel room. Cost me $20. The medications cost me $11. They told me I could take the bill for the medication, and I could give it to my insurance company back here at home and get reimbursed. I was traveling in Taiwan, and in Taiwan, a friend of mine was traveling with me, fell and injured his head. He got stitches, got taken care of. He asked, how much do I owe you? No cost. I'm a little confused. You know, our goal should be people should be able to get health care. Instead, we're talking a lot about how we have to keep insurance companies interested in offering people access to health care. And one of the reasons that we're here right now, I think, is what I heard when I was door knocking is from people who said, my premium shot through the roof. I couldn't afford them. And not only that, the plan that I had such high deductible, I never went to the doctor. I couldn't use it. That's not access to health care. That's not the ability to get health care. When I was in California at a family dinner, one of the people at the dinner said, you know, I'm a diabetic. And I can't, this was before the Affordable Care Act, I can't get access to health care. I have to do the best I can with the gardening job I have to keep my insulin, to get medications, to occasionally go see a doctor, but it's really hard to afford it. And I said that awful word, oh, maybe California should consider single payer. And, you know, Representative Davids made the offhand comment that Representative Johnson's bill was single payer. It isn't. It's just trying to give people one more option in that marketplace of insurance, the possibility of maybe getting a lower premium, maybe with better coverage, maybe getting access to get to the doctor. But we're not interested in that. We're not interested in making sure that people can get to the doctor. We want to make sure that they can choose the best insurance policy that they can get. An insurance policy for what? The insurance companies sit between you and your access to health care. The insurance companies, when we're going to try to pass a bill to make it to meet that goal of having people get access to health care, to get health care, they sit there and they say, no, we've got to have our profits. Or no, we've got to have our ability to make as much money as we can. Or no, we can't use the money in our reserves. We have to keep it really high. It all has to balance out. We have to make sure that it works for us. So when I said to the gardener who was diabetic and didn't have access to health care, the host at the dinner said, we couldn't have single payer here in California because I work for the insurance company and I wouldn't be able to make all the money that I make if we had single payer. So what this is about, it's not about access to health care. It's not. It's about making sure that insurance companies are solvent, that they can do whatever they want. I share concerns about rural hospitals and rural providers. I do. But I'm not sure that high premiums and high deductibles make it possible for patients to go to the doctor, to use those hospitals. How is that better? Whether they pay the full amount or not, which they don't. So I was hoping to get up and speak for Representative Johnson's option, because I think it does get us closer to making it possible for people to get health care. You know, competition's great, competition's a fine thing, but I would rather have doctors and hospitals competing for my health care dollars than the insurance companies. Why not? Why not? This is a bill that isn't going to solve our problem. It's going to give more monies to assure that the insurance companies can stick around a little bit longer. But it's not going to make it more possible for people to get health care. Thank you.
Member from Nicollet, Representative Johnson.
Thank you, Mr. Speaker. And frankly, members, I was surprised I was cut off on the amendment. I'm not always sure I understand the rules here all that well, but I always thought it was custom of this body that the author of the amendment kind of gets the last say on it, the last word. And I didn't think the debate was over with. And I don't know how to solve that, but I do want to comment on it. Because I think it reflects kind of a fear of this body or the leadership, or I don't know who's running this, but a fear to really discuss things and really to talk things through and really to get to the heart of the matter. It's been frustrating. We haven't been able to get a hearing for this bill. You know, the governor of the state asked that we consider this. He's our leader. He's well respected by us. This is a primary proposal that he made to the people of Minnesota, and I'll tell you, a lot of Minnesotans said, yes, that's something we could do. I asked my colleagues on this side of the aisle to co-author the bill, and 45 of them joined me. Senator Sharon, Kathy Sharon, who's now retired, and currently Senator Tony Laurie in the Senate, have been championing the MinnesotaCare buy-in. I don't know two people anywhere in Minnesota who know more about health care than those two individuals, two really distinguished legislators, one retired. So the fear of discussion and dialogue holds us back. It keeps us from really trying to consider what we can find in common, what we can do to really advance something. This is a problem that we all know about. We heard about it all fall. We know it exists today. We have no assurance coming forward into the fall that there will be a healthy insurance market, and to suggest that HF5, as currently constructed, will guarantee that, I don't think anyone's willing to say that here either. So there's a lot of confusion in this market. The MinnesotaCare buy-in was a reasonable alternative. And then let's take another step back when we voted down the amendment to allow this to come in and march forward with the reinsurance approach. What a lost opportunity. to have a vigorous discussion in a conference committee about real options before this legislature, about what we can do to solve problems that are so real and so costly to our neighbors. The woman today who spoke about spending $30,000, we've all said it, the people who are spending $30,000 a year out of their pocket for their health insurance, they need better from us. They absolutely need better from us. We missed an opportunity, therefore, to move forward. You know, both of these proposals need work, but I really pictured the next couple of weeks, and the timing is so good. Representative Davids, you got this bill to the floor when it needed to get here. The timing is good. This is the month we needed to do that, and I think that's an accomplishment. But the choice has been made, well, in a way, I felt like the debate was cut off, but a choice has been made to move forward without really looking closely at what are some really valuable alternatives. And I think it's a crucial mistake for the process. More importantly, it's a crucial mistake for Minnesota families. I don't think Minnesotans are saying, give me fewer choices. I don't think Minnesotans are saying, yeah, spend $400 million with no guarantees that I'll get more choices. I don't think Minnesotans are saying, yeah, take care of those insurance companies first, those doctors first, and then worry about me, the patient, the insured. I don't think they're saying that at all. I think they want some real solutions. And I think we failed them today with this bill, the way this bill has been approached. We missed an opportunity to really try to meet the needs of these people, to march forward in a way where we could consider real alternatives and solve problems that are real to very real people in the state of Minnesota.
Member from Wabasha, Representative Drazkowski.
Thank you, Mr. Speaker and members. I think Representative Bennett said it well. It's deja vu all over again. And it wasn't long ago, and I was here as well, and many members were here in 2013, when the Democrats rammed this through the Minnesota legislature. They wouldn't listen. A big government solution was the only solution. And they brought it through, and they rammed it through without any other input from our side. They wouldn't accept it. And through the course of time, we saw as the government solution failed again and again and again to meet its benchmarks. It didn't even meet the first benchmark. And then it dropped further, and it dropped further, and it dropped further. And we plowed $300 or $400 million into a failed MinSure. And now even Commissioner Rothman is admitting that the market is on the verge of collapse. Now, we have to do something. And it's very frustrating for me and many of us members here to be put in this position we're in. Just last month, we spent $300 million to help offset the costs, the huge costs for Minnesotans, hard-working Minnesotans that work hard every single day and are paying for the Cadillac-style health care coverage of many people who don't work. And those people who work hard and pay those bills can't afford to buy their own health care. It's horrible that we're put in this position. And we're right on the fulcrum right now. We hear some members in the Democrat Party say, you know, we have to, Representative Clark Johnson, we got to have a government solution. We got to have a government solution. We've got to expand it even further. Representative Bly, just trust us. Just trust us. This government solution is really going to work. Well, members, the people of Minnesota and the people of America think differently. And it doesn't work. It's time for a different direction. Now, is Chair Davids' proposal perfect? Probably not. But at least it's going to help us to preserve the free market and bring freedom back to health care. It's a verge of the ability for us to bring in some reforms that will bring health care markets back again from the hands of government that have crushed it. So members, I'm going to vote for the bill today. Representative Davids, I've talked to Chair Davids, and the one concern I have with the bill is that we don't have it very clear. Yes, it's a lot of money, Representative. But you know what? You put us in this position in 2013. And Representative Davids, I've talked to him. The part that I have concern about is I want to see us, when we get to conference committee, have this funding end after 2 years. And I want to see a deliberative requirement from the legislature, from the House, the Senate, and the governor, the moon and all the stars aligned to say, this is what we need to do again. I want a deliberative approach and not something written into law for the long term. Chair David said he would entertain that idea and have discussions. I'm going to vote for the bill today, but if it comes back from conference as a long-term government program, realizing 2 years should be enough time for us to get solid reforms in place so we don't have to be here spending more money. If we can get to that point, I'll vote for it on final passage. Otherwise, I won't. Thank you, Mr. Speaker.
The member from Meeker, Representative Erdahl.
Thank you, Mr. Speaker and members. And with all due respect to my friends on the other side of the aisle, let me be succinct on this. If you hadn't given us such a bad health plan, we wouldn't have to fix it.
The member from Carver, Representative Hoppe.
Thank you, Mr. Speaker. Mr. Speaker and members, I will just touch on a couple of things. It has been mentioned today that we have more people with health insurance in the state of Minnesota than we did, and I think that's true, but we went up somewhere around 4 or 5%, and to get that, we spent roughly $400 million. The truth of it is that a lot of parts of our country didn't have anywhere near the same kind of health care or health insurance that we did in Minnesota. Representative Slocum and I were in Louisiana a week and a half or 10 days ago. We heard the governor of Louisiana give a speech and talk about how many people now had insurance in Louisiana that didn't before. I think Louisiana was one of the states that probably needed something like the Affordable Care Act. I think the truth is, in Minnesota and the other states like Minnesota and Wisconsin that had this figured out, we didn't really need it. So we are insured 4% more of our population for about $400 million. Now we're having to spend some money to try to essentially get back to where we were before the Affordable Care Act. This is not a perfect bill. The author is great, but it's not anybody's ideal bill. We wish we weren't here having to do it. Representative Bly, you talked about competition. We need competition. That would help us. Not just from the providers, that would be great, but also from the health insurance companies. If we have more competition and more people trying to look at taking care of and insuring people, that would be great. If we can look at some things where, everybody says things like out of the box or take a different look at it, however you want to put it. Let's take a look at some of the things that we've always done and say, do we always need to do that? Why don't we start looking at right now, everybody in this room has health insurance. Nobody cares what they pay for health care. You care what your deductible is, you might care where your pediatrician is, but you don't care what it costs, even if you know it gets taken out of your check or somebody's paying, because we have a deductible system. Let's start looking at going to some sort of a copay system for everything, where preventive care is covered, but people have a little bit of skin in the game, no matter what they're looking to do. And obviously people, the bigger things, the tragedies, the accidents, the cancer diagnoses, things like that are going to be covered. But rather than all of us just being sort of blind consumers and just saying, well, I have health care, so I'm going to go to the doctor, I'm going to do this, and not caring, essentially what provider or what institution or where, not caring at all about the cost, let's all of us and all the citizens of the state start looking at that as well. So I think there are a lot of good ideas here on both sides of the aisle. I think there are a lot of things that we could be looking at, different ways of doing things. And I think that this is a step towards getting us back. We don't want to be here having to do this, but I think this will help the individual health insurance market in the state of Minnesota, and I would encourage members to vote green for Representative David's bill today.
Member from Roseau, Representative Fabian.
Thank you, Mr. Speaker. Members, and Representative Hoppe touched on this, and I'm reminded of what Representative Bly said a little while ago about how he thought competition should be between doctors and facilities. Mr. Speaker, if Representative Eklund would yield to a question, please.
He will yield. Representative
Thank you,
Fabian.
Mr. Speaker. Representative Eklund, what cities you live in International Falls. What cities have medical facilities closest to you?
Member from Kuchiching, Representative Eklund.
Thank you, Mr. Speaker. Representative Fabian, International Falls. We got a hospital across the river in Fort Francis. We can't use that. Cook, Ely. There are clinics. There are clinics in Northolm and Little Fork and Big Falls.
Representative Fabian.
Thank you, Mr. Speaker. Thank you, Representative Eklund. And the reason I asked you is because you and I have a lot in common. We live in an area of the state that's very sparsely populated, and the distance between our medical facilities is tremendous. Mr. Speaker, if Representative Bly would yield to a question or two, please.
He will yield. Representative Fabian.
Representative Bly, can you tell me how far is it from International Falls to Cook?
Member from Rice, Representative Bly.
I'm sorry, Mr. Fabian, I don't have that information in my head right now.
Representative Fabian.
I'm sure you'll be able to tell us.
Representative Fabian.
Mr. Speaker, no, as a matter of fact, I can't tell you, but I know it's a long ways. I can tell you, Representative Bly, how far it is from Warroad or Roseau to Thief River Falls, 65 miles. I can tell you how far it is between Roseau and Hallock, about 60 miles. I can tell you how far it is from Roseau to Badette, 65 miles. I can tell you how far it is from Warroad to Warren, 125 miles. What you're talking about competition in our facilities is totally unrealistic. People are not going to be able to go to doctors and facilities in different towns and get competition that way. It doesn't work. People don't want to do that, and they will not do that. So your idea of competition is a bad one. Mr. Speaker, if Representative Bly would yield to a question again, please.
He will yield. Representative Fabian.
Representative Bly, you talked in your presentation, your speech here on the floor, you talked about traveling around the world and even to California. When was the last time you were in Manitoba?
Member from Rice, Representative Bly.
I haven't had the pleasure to be in Manitoba yet. You know, perhaps you're just so hungry for competition, you want to have insurance companies competition instead of the competition for doctors and hospitals. I do understand the problem of population and how if there are not enough people to access health care in a certain area, there's not going to be enough money for the kind of competition that we're talking about. And I'm sure you're going to bring up single payer in Manitoba. Well, you know, what I hear is that people in Canada that I talk to are very happy with their health care system. And because they know that their neighbors are going to be able to get access to health care. And I know you're probably going to bring up, oh, there's these waiting lists. Well, I've heard about that problem too, and it's a matter of a problem that they can solve by making sure that they put more money into their system. But, you know, I don't see how it's so important to have competition between insurance companies just because you don't have enough hospitals to have competition.
Member from Roseau, Representative Fabian.
Thank you, Mr. Speaker. Well, I live just a short distance from Manitoba, Representative Bly. And the hospital in my community in Roseau has a contract with the Manitoba government to provide medical services. And I spent 20 years managing the golf course in Roseau in the summer months and had lots of conversations with people from Manitoba who would come down for a clinic appointment, doctor's appointment, maybe some sort of treatment, and maybe before or after they would come to the golf course and enjoy a beverage or a round of golf or something like that, and we'd get to talking. And you're right, you know, people in Canada do like their system. But what I was told by the people from Manitoba, the only people who like the medical system in Canada are the people who don't have to rely on it. The people who need medical care do not like the Canadian system, is what I'm told. And when they're given the opportunity to decide between coming to the facility in Roseau for high quality and used to be low cost care, now because of what you folks have done to us in the last several years, the costs have gone through the roof. They would prefer to come to Roseau because it's more timely and it's better care. And so the idea that somehow or another we're going to create competition in rural Minnesota and improve the lives of people by having them shop for doctors and so forth, it doesn't work. And the Manitobans that I talked to, and it was heard in testimony and committee members, okay, we had a representative from the Life Care Hospital testify in committee when we were talking about access and the Blue Plus plans and so forth. They talked about how the Canadians across the border from Roseau, given the opportunity, preferred to come to Roseau rather than going to Steinbeck or Winnipeg. Thank you.
Member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Members, it's remarkable the number of Republicans I've heard rise to speak on this bill who have risen not to defend the bill, but to besmirch the previous plan. And that's fair, that's your right. But I haven't heard a lot of you really defend the merits of this plan. To give $386 million to insurance companies, that's your idea? You may not be aware that the Congressional Budget Office came out with an assessment today, the nonpartisan Congressional Budget Office, that said the National Republican plan will cause $24 million to lose health care coverage over the next 10 years. And yes, it would save money. But that's what you're going to saddle Minnesotans with in your plan. You're going to reduce health care access for Minnesotans, and you're going to pay insurance companies to do it. Now, there's no guarantee in this bill that I looked, and I looked right there at where Representative David said on page 5, subdivision 2, payment parameters. It says that the board must design and adjust the payment parameters to ensure that the payment parameters will stabilize or reduce premium rates. I don't know what that says, but I know it's not a guarantee that it's going to bring down health rates. And I've heard all kinds of testimony from insurance companies that came in front of Republican committees this year asking for special benefits. And when asked, is this going to reduce my insurance rates? They said, can't promise that. So what you're talking about is gambling. And to your credit, before the last election, all the rates came out for increased health care rates, and you played that violin, you played it like a virtuoso. Congratulations. You got your minority, you got your majority, you got your 20-seat majority. But when you pass this plan, you're going to own it. So 18 months from now or less, when some of you who hold these seats that might be on the edge, and I think you think you got them, but you don't, you're going to go up to that door in your district. Hi, I'm your local Republican representative here to ask for your support for re-election. Oh yeah? Well, right before the last election, you said you were going to solve that health care problem. What'd you do? Well, we let HMOs be for profit, and we gave insurance companies $386 million in reinsurance. Well, what did that do for me if I don't have coverage? That's going to be a really tough question to ask. And what are you doing? You hear folks say, well, no, seriously, we're going to give them all this money, hundreds of millions of dollars, and maybe it'll create a better market. Well, that's like going to the casino. You want to go to the casino, and you want to put hundreds of millions of dollars down on health insurance companies. I can't think of a worse bet. Now, listen, I don't do health care, but I was a prosecutor for 15 years. And when a case came across my desk where there was a bunch of people all blaming each other, you know where I started to find out who was really to blame? I started with the person who benefited most. And sometimes that was not the person I ended up charging, but very rarely. Health insurance companies have benefited more from health insurance cost increases than anyone else in this economy. And your constituents have all paid. And now you want to take more money and give it to health insurance companies like you're going to the casino. Putting on a number and letting it ride. And you know what happens? There's one rule I know about when you go to the casino, and that's that the house always wins. You know that. Your constituents know that. You're making a bad bet. Vote this in. But you're going to own it. You're going to own it in 2018.
Member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker. Thank you, members. Thanks, Representative Davids, once again. Just a few numbers. So, $400 million or so from the Healthcare Access Fund to pay for reinsurance, and reinsurance that we don't have any guarantee will reduce premium rates or stabilize the market or expand networks. $12 million for MinnesotaCare buy-in. So there's a difference. The woman that testified today earlier in the press conference said $30,000 a year for her health insurance right now in the individual market. The estimated premium per month for somebody in MinnesotaCare in the buy-in would be $460. So that's $5,520 a year in comparison to the $30,000 a year currently. So that's a difference. That's a significant difference. Representative Matt Dean, was right that things changed in November, and we have President Trump, and you have a majority, and you have this problem to solve. And we are here offering a solution. You're rejecting it out of hand. We understand that. But I think that Minnesotans, as they listen to this debate, would understand that we're offering a solution that would provide them access to a stable market for an affordable price. And what they want is some security in their health care. The woman who came and spoke at the press conference today with a sick child and a $30,000 a year bill wants some security. She wants to know that there's health care that's affordable and reliable that she can afford, so her child gets the care that he needs. Representative Davids in committee said the only numbers he was paying attention to was 68, 34, and 1. 68 votes here, 34 in the Senate, and 1, that would be the governor. So we know where you're going to go today. You're going to get your 68 at least votes for your proposal. It's expensive, no guarantee for people that it's going to solve the problem. But we do know that you're making a choice in terms of priorities, and that is this. When you pass this bill today and take it to conference, you're putting your priority in making sure that the powerful health insurance companies in Minnesota are getting their due. And behind them, with a question mark, is the cost of care and the premium rates that Minnesotans are paying. That's the choice you're making today. 68, 34, and 1. We'll see if you get your 1. As my father-in-law used to say, Representative Davids, jolly good luck. Please vote no.
Member from Hennepin, Representative Hortman.
Thank you, Mr. Speaker. Members, I'm back to the more comfortable position of disagreeing with Representative Drazkowski. Representative Drazkowski, there is nothing free market about House File 5. It is a $386 million subsidy to health insurance companies, and there is nothing free market about that. This Republican plan puts insurance companies first with no guarantee that it will actually help Minnesotans. House File 5 has a very high cost of $386 million without any guarantee that it will actually reduce costs or increase healthcare access. The MinnesotaCare buy-in option deserves to be considered. It should be part of the conversation. It is a proven way to reduce costs and provide more access. We know that healthcare can be delivered at a lower cost, and we're doing that in MinnesotaCare. Minnesotans are struggling in the individual market, and they need our help. They deserve to have choices. The MinnesotaCare buy-in option is just that, an option. It should be on the table. It is potentially far less expensive than what we have in front of us today. Members, families deserve support, and they're not seeing any guarantees of any help in House File 5. Members, we should vote no on House File 5 today.
The author of the bill from Fillmore, Representative Davids.
Well, thank you, Mr. Speaker, and thank you, members, for the debate. I must respectfully disagree with a few things that have been said, and they certainly sadden me. One of the people that just talked said that the Republican priorities are the big insurance companies. That's not true. But if you vote against this bill, you know, I don't know exactly what's going to happen. I don't know how well this works, if it works. I think it will. Reinsurance plans across the country have worked, do work. I think they will work, but I'm not going to sit there and make guarantees to people. I'm not going to write checks my body can't cash. But to suggest for 1 second that this is about the big evil insurance companies is just not true. This is about getting people, your constituents, affordable rates. So you can say, well, I guess I don't want to do this. I'm not going to vote for this. But what's the alternative? The alternative is not the MinnesotaCare buy-in. That's fluff dust is what that is. Because what you're doing is you're charging a premium. You're going to close out every rural clinic, every rural doctor, every rural hospital if we go with that. And then you say, well, it's an option. You don't have to take it. Well, what it does, it destroys the individual market. So what you're voting on today is being able to keep an individual market and hopefully to bring prices down. And, you know, for anybody that's thinking about voting no, you might want to talk to Commissioner Rothman. The department, the governor's office, and I have been working very, very closely, and he's been pretty clear. I hope when Representative Bly said the things about, you might want to talk to Commissioner Rothman. You kind of feel like I'm getting beat up here a little bit but I can take it. But, I'm trying to help the governor. I'm trying to help the Commerce Department. And I have all of my friends on this side of the aisle saying things that hurt my feelings. So, with that, I just need to make a couple comments here. First of all, how many times have we heard today that the for-profit HMOs was brought to us by Republicans? How many times do you hear that? I counted 11. Now, just a second here. Senate File 1 was passed 108 to 19 and signed by my good friend, our governor, DFLer Mark Dayton. So how did the Republicans bring it to you, the for-profits? Signed into law by a DFL governor, good job, governor, and voted on by a lot of my friends on my side of the aisle here. So the problem with the DFL solution is it doesn't work. It destroys the individual market. And yes, I will go to 68, 34, and 1. Those are the only numbers I really think about. 68 votes in the House. Hope we do better than that today, sports fans. 34 in the Senate, who knows? And 1 governor to sign it. Now, in talking to Commissioner Rothman and the need for this, I think we got a pretty good shot there. But why discuss an option that doesn't work and can't meet my 3 numbers of 68, 34, and 1? So members, I'll close in just saying that you can say whatever you want to about costs, about what this will cost, but I hope you think about what it costs if this fails and you would vote red. So please vote green. Need your help. 68, 34, and 1.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll.
Mr. Speaker.
Representative Albright votes aye. There being 78 ayes and 53 nays, the bill is passed and its title agreed to. Call upon the member for purpose does the member for my task arise?
Mr. Speaker, I rise for a point of personal privilege.
State your point of personal privilege.
Mr. Speaker and members, this weekend many of us attended one of our state's great youth sports competitions, the Minnesota State High School Hockey Tournament. The best teams from around the state came to St. Paul and played some of the most exciting, skilled, and intense hockey games you will ever see. After 3 hard-fought games, the Grand Rapids Thunderhawks, after 37 long years, won and became the Class AA state high school champions. I'd like to congratulate the players, the coaches, the managers, the parents, the countless fans on winning the state tournament. We are so incredibly proud of the team's performance. Please join me, if you would, in congratulating the Grand Rapids Thunderhawks on being the 2017 Class AA state champions.
I'm looking for Representative Lean to see if he has any comments. No? Motions and resolutions. There's a copy of the non-controversial motions on the House desk and online. If there's no objection, we'll take action on these motions first. Hearing no objections, the motions prevail.
Lesh moves that House File Number 837, now on the General Register, be re-referred to the Committee on Civil Law and Data Practices Policy.
Member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Members, this is a transportation bill which has a very glaring data practices component to it. And so I was going to move to refer it to civil law. However, I got reassurances from Representative Scott that we're taking up that bill with those provisions on Thursday. And since I always believe whatever Representative Scott tells me, I'm going to withdraw the motion.
Announcements. Member from Roseau, Representative Fabian.
Thank you, Mr. Speaker. Members, GOP members of the Environment Committee will have a short huddle in 300 North after session.
Member from Ramsey, Representative Jessup.
Thank you, Mr. Speaker. Just want to remind everyone that after we've had a spirited debate here this afternoon, we, as freshmen, welcome and invite you to the Lexington restaurant. Our reception is to begin at 6:30. We are looking for some congenial conversation this evening. And chairs of committee, if you are meeting right after session, my strong encouragement is that you keep your meetings very short. Thank you, Mr. Speaker.
Announcements. Representative Gunther.
Thank you, Mr. Speaker. The Legacy Committee will meet at 6:05 in room 10. Be there. There's a 5-minute limit for Bill.
Representative Pepin.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 10 a.m. Tuesday, March 14th, 2017.
Representative Pepin moves that when the House adjourn today, it adjourn until 10 a.m. Tuesday, March 14th, 2017. All those in favor, please signify by saying aye. Opposed, say no. Motion prevails. Representative Pepin.
I move that the House do now adjourn.
Representative Pepin moves the House do now adjourn. All those in favor, please signify by saying aye. Opposed, say nay. Motion prevails. The House stands adjourned until 10 a.m. Tuesday, March 14th, 2017.